Welcome everyone. So now we are going to look at pacemaker action potential of heart and different waves of heart. Heart is acting as the pump and it has four chambers. Like it is a muscular organ having four chambers and it pumps the blood. Let's suppose this is right side of the heart, this is left side of the heart, and from right side there is pulmonary circulation and from left side there is systemic circulation. So in normal physiology what happens, blood from all the body goes down into right atrium, and then from right atria it goes into right ventricle, and from right ventricle blood is pumped via pulmonary arteries that carry deoxygenated blood to the lungs, and from there oxygenation of blood happens, and that oxygenated blood returns into left atrium. In left atrium, that oxygenated blood goes into left ventricle, and it is pumped via aorta into the whole body in systemic circulation. So in this way blood is pumped in the body, and that pumping mechanism is known as circulatory system of the body. Now in that pumping mechanism we record the rhythm of heart, and that rhythm of heart is known as ECG, electrocardiography. And electrocardiography gives a certain clue about heart activity, that what kind of activities heart is performing, and these activities can also give us clue about certain pathology of heart. Now let's suppose this is P wave and this is Q wave, R wave, S wave and T wave. P wave, Q wave, R, S and T wave. Now these waves represent different mechanisms of heart. We will be looking at these waves. Now here in this picture, five prominent points on ECG are recorded via P wave, Q wave, RS wave, T wave, and often we can get U wave as well. So in this way these different points represent different cardiac activities. Like P wave shows atrial depolarization, means atrial contraction. When atria gets depolarized, contract and are and the heart pumps blood into ventricle, then QRS complex is formed for ventricular depolarization, and ventricular depolarization is represented with QRS complex, means ventricles are going to be contracting. Then T wave is formed when ventricles are relaxed and repolarized. T wave is formed, sorry. In this way the whole ECG is formed as P, Q, R, S, T wave, and sometimes U wave is also present. Now this is normal ECG. In pathological conditions we are confronting with abnormal ECG as well. Now here in another slide we can see that there are different patterns on ECG. Like if P wave is larger, that means atria are enlarged and it is taking more time in contracting, that's why they are enlarged. Enlarged Q wave indicates MI in heart attack. Enlarged Q waves are there. Enlarged RR interval shows enlargement of ventricle. R flat T wave indicates insufficient supply of oxygen. For myocardial ischemic condition can result in the flat T wave will be flat, and uh, in large PQ interval indicates formation of scar in the heart and Loeffler syndrome, and large QT interval indicates MI, damage, coronary ischemia, or conduction abnormality. So in this way these different events represent different cardiac activities. Like there are also other waves that are atrial pressure curves, like A wave, C wave and V wave in some conditions, and we will be looking at in further lectures. And For our basic knowledge, we have to look at these simple waves and their correlated functions.